My name is Blake Lawrence, and I'm a research fellow here at Curtin University in the discipline of psychology. And my colleagues and myself have recently published a study looking into weight bias among healthcare professionals and how this can have a negative impact on many people living with overweight and obesity. But first, what is weight bias? So weight bias is generally described as sort of the negative perceptions and assumptions and attitudes that people have towards other people living with overweight and obesity. So within a healthcare setting, some studies show that some healthcare professionals have a weight bias, and this can often lead them to assuming that their patient may be lazy, less likely to follow their medical advice, and have just a sort of general lack of care about their overall health. And other studies have shown that a weight bias in a healthcare setting can actually also have an impact on the provision of care that a healthcare professional provides to their patient. So in our study, we reviewed all of the previous studies done on this topic, and what we found was that a weight bias was present among medical doctors, nurses, dietitians, psychologists, physiotherapists, physical assistants, occupational therapists, speech pathologists, podiatrists, and exercise physiologists. So generally the takeaway message there is that for many people living with overweight and obesity who participate in the healthcare system, they are likely to experience a weight bias, which could have a negative impact on the care that they receive from their healthcare professional, and also have a negative impact on their willingness to want to continue to participate in the healthcare system. So the other finding from our review was that the methods used in the previous studies do need to be improved moving forward. So a lot more research needs to be done in this area. So then once we improve the research that we are doing, we can then start to design interventions to hopefully reduce the experience of weight bias in healthcare settings. And I also have a personal motivation for this research, because I was previously somebody living with overweight and obesity right through my childhood into adolescence and into early adulthood. And I can remember distinctly the negative experiences that I had in healthcare settings and more broadly around the sort of bias and the stigma that is associated with living with overweight and obesity. So hopefully through the research that myself and my colleagues are doing now, we can begin to address this issue and improve the experiences in healthcare settings for many people in Australia currently living with overweight and obesity. Thank you.